Every few years, the World Health Organization brings together experts from across the globe to look at the latest evidence and then make recommendations about which interventions and approaches for HIV work the best. These become part of the international guidelines which are shared with countries to support them to deliver care for people affected by HIV, including young people. We all know, living with HIV involves so much more than just the medicines and the blood tests. The World Health Organization wants to make sure that the guidelines also give countries advice about how to help young people living with HIV beyond the pills that you take to treat the virus. They want to provide guidance on how to best support young people's well-being, which we often call psychosocial support. So in 2020, we talked to lots of young people living with HIV on behalf of the World Health Organization to find out from those who know best. We asked them for their opinions about how psychosocial support can improve young people's engagement in care and other health outcomes. 388 young people living with HIV, aged 10 to 24 years old, took part from 45 countries. Young people took part in two ways. All 388 young people took part in an online survey, and 61 young people from 10 countries also took part in group discussions. This global community of young people told us how the lives of young people, as well as their understanding of HIV and treatment, all influence whether they are able to engage with clinical services and take their treatment. Young people told us loud and clear that when they are receiving psychosocial support, such as peer support, counseling, support groups, this improves how they feel about themselves and can help them to have a clearer understanding of their own health and treatment. This includes knowing that taking the treatment effectively can bring the virus under control and keep them healthy now and the future. This really motivates them to adhere to it. Ongoing adherence leads to continued control of the virus. This is called viral suppression and works in a cycle. When their viral load is suppressed, this improves their mental health and further encourages them to adhere. If psychosocial support is not provided regularly, these gains are lost. Psychosocial support is needed on the good days and should be there to hold young people up and get them through the more difficult days. Psychosocial interventions should be sustained over time as a young person grows and develops into adulthood. When psychosocial support is ongoing, young people continue to benefit and the effects grow. Young people told us that psychosocial support is essential for their well-being, mental health, and social connectedness. This has a direct effect on the success of the clinical services they receive. Without psychosocial support, the clinical effectiveness of art will not be realized. Here is the great news. We shared our findings about how psychosocial support can be for adolescents and young people with a group of experts from the World Health Organization in October 2020. They all agreed that the new World Health Organization guidelines must strongly recommend that countries include psychosocial interventions for adolescents and young people living with HIV, recognizing that the evidence is clear. They have direct effect on young people's engagement in care, success on treatment, and their well-being. The World Health Organization is now launching its 2021 guidelines with the recommendations. As countries adapt their own guidelines, we are likely to see that they too adopt psychosocial support in their national guidelines. If you're watching this and you're one of the experts who told us all this, thank you for taking part, sharing your views, and shaping global policy. We have learned so much from listening to you. Your ideas have made a big difference, and your views will directly influence the lives of young people worldwide. We really hope that when the guidelines are released, you will join the efforts to promote them and ensure the recommendations can really change things for adolescents living with HIV.